Welcome to Michael Braithwaite's session 2, Stream 1. I'm your moderator, Liz Pia. If you're looking for a different session, you'll be able to find all the sessions in the menu on the left. Click on the session tab and click on the session that you're interested in attending today. It's my pleasure to introduce the speaker for this session, Michael Braithwaite. For the last 11 years, he's worked with organizations dedicated to preventing and ending homelessness. He's currently the CEO for Blue Door Support Services, a charity in York Region, working to rapidly rehouse men, families, and youth, as well as providing them access to health and employment services. Welcome, Michael. We are so looking forward to your chat today. Thank you.
Thank you so much, Liz, and thanks everyone for attending today and for your attention. So my name is Michael Braithwaite. I am the CEO of Blue Door. I work with an amazing and very talented, much more talented than myself, group of over 100 people at Blue Door. Blue Door has been around in York Region for, this is our 40th year. And for about 35 of those 40 years, we were really focused on emergency housing for men, families, and youth. But in the last 5 years or so, we've moved into secondary housing, so transitional housing, permanent housing. We set up some housing that was much needed for 2S LGBTQ plus youth. We've started a land trust. We've got into partnership on a fourplex, creating space for women fleeing violence in one of our apartments, and a fourplex with yellow brick house. And so the work goes on and on because the need goes on and on. So today what I want to talk with everyone about is a little bit about, it's kind of like a homelessness 101, but in relation as well, and we'll focus on intimate partner violence and how it relates to homelessness as well. If you were a grade 3 class and I came out and I asked the question, what does homelessness look like? You would answer me because many kids at grade 3, they've yet to establish a filter going forward. So when I ask them, what does homelessness look like? They usually describe what they see on the streets of downtown Toronto, right? So they'll say an older man, maybe with a big beard, asking for change, etc. When it comes to look of it, they're actually describing me. And so they're describing what you see on the streets of downtown Toronto. And while they're not wrong, that is a small percentage of homelessness. Street homelessness that we see, of course, very serious. We work towards ending that. But homelessness does not have a look. Homelessness is more of a feeling of fear, isolation, of loneliness, confusion. It is a feeling. So it's not really a look. It really could look like any of us at any point, because through life changes, and we'll talk about some of those, people experience homelessness at different times. So let's talk a little bit about that. We actually have a formal definition of homelessness. Sorry, Liz, it's telling me I'm muted, but hopefully not. Can you hear me okay?
Yep, I can hear you.
Okay, perfect. Sorry about that. So we have a formal definition of homelessness that comes from the Homeless Hub. If you're ever looking for any amazing information or research around homelessness, the homelesshub.ca, which operates out of York University, is a great place to start. So you see, homelessness describes the situation of an individual, family, or community without stable, safe, permanent, or appropriate housing, or the immediate prospect means or ability of acquiring it. And then it talks a little bit about it's a result of systemic or societal barriers, a lack of affordable and appropriate housing in the individual's household, financial, mental, cognitive, behavioral, or physical challenges, and or as racism and discrimination. And so for the longest time, we only have one definition of homelessness. And we know that, unfortunately, with people experiencing homelessness, and you'll hear me say people experiencing homelessness, we want you to take a people first approach to it, right? It's their situation, it's not who they are. A person experiencing homelessness is a father, is a mother, brother, sister, aunt, friend. They're people first, right? So we say people experiencing homelessness. But people experiencing homelessness, when we look at point-in-time counts, when we actually across the country, we go out and we try and assess how many people are actually experiencing homelessness. In almost every community, especially in the GTA, Indigenous people are a small part of the population, but way overrepresented as people experiencing homelessness. And homelessness has a different kind of relation for Indigenous people, right? So I'm not going to go through this whole definition, but Jesse Thistle and some others wrote this a few years back. And it really is more the connection to nature and to the land, that kind of a thing, than the actual physical house. And even today, when we think about it, homelessness looks different for all sorts of different populations, women fleeing violence included in that as well, which we're kind of, we'll talk about, were the invisible people experiencing homelessness. And we're going to, if you have questions at the end, please write them down. I'm happy to answer them. Okay, so we see some of the facts here. I started off with this one, 17,350 people staying in emergency housing fleeing violence each year in Canada. And it's very hard to get a finite count on how many people experience homelessness, but it's estimated between 150,000 to 300,000 individuals experience homelessness in Canada in a given year. So that's a lot, right? And that's a lot of hidden homelessness too. That's not what we see. In York Region, where Blue Door operates, we have 9 municipalities. It's a massive geographical area. So it's really spread out. So you wouldn't actually see a lot of street homelessness. But at any given night, there's an estimated 1,500 people experiencing homelessness and only about 300 emergency beds. So there's a huge gap. In 2021, there was a GTA food bank survey done, and there was a 47% increase in the number of people accessing food banks. And largely due to the pandemic, it just costs going up and up and up. And so you see people, there isn't really a housing bank that they could go to, but there's a food bank. So people will pay their housing first, and then what they have left over, they'll use for food or have to access the food bank. And so people accessing the food bank after paying for housing had $9 left over, and Indigenous and Black communities had $6. That's for their entire family. So you see how easy it is for people to slip into homelessness when they can't do that, right? It's recommended that the average household spend 30% of your household income on housing. But in the GTA right now, people are spending 80 to 90% of their household income on housing. So it doesn't leave a lot left over at the end. And that's just due to the rising cost of housing. Every night, there's close to 30,000 people that are experiencing homelessness. And then you see the number of people using 14,400 who use emergency shelters each year. I call it usually emergency housing because even if it's for one night, it's someone's home. We have to treat it like that. So it's emergency housing is what we call it at Blue Door. And listen, you know, when we think of 75 to 80% of people who come in, they're one-time users. They come in, they get some supports wrapped around them. They reconnect to their community and things happen and they don't experience homelessness again. It really is that 20 to 25% who are chronically experiencing homelessness that are tougher to serve because there's multiple things happening, whether it be family breakdown, addictions, mental health challenges, physical health challenges, financial challenges, etc. So how does someone come into homelessness? People always say, well, so why? Why should, and there's that famous, unfortunately, our premier, I think, said that the best solution is a job. There's many, many reasons where people fall into homelessness, and it's not, unfortunately, sometimes too, if you ask people, they go, oh, is that person just lazy? And not at all, right? So there's structural factors, which economic, societal issues that affect opportunities and social environments for individuals. So that could be, that's where your finances come in, access to actual housing you can afford, health supports that you're not getting, and experiencing discrimination too. So we see higher levels of people experiencing homelessness in areas where in Toronto, so disadvantaged areas, et cetera, right? So there's system failures too. So we actually have designed systems that have launched people into homelessness and continue to do so. One of them that I think of often is our child welfare system, so CAS or FACS in some parts of Ontario. So kids that enter into foster care, and so many youth who experience homelessness have been a part of the foster care system, but at the age of 19, their birthday present is, we no longer can help you, right? You're out of the system, you're on your own. For a 19-year-old to be on their own and not have any supports to fall back on, the chances of them falling into homelessness increases rapidly, right? So many of youth who experience homelessness have been in the child welfare system. So we have to fix those systems. Also, incarceration. Someone maybe has a small skirmish with the law. They're incarcerated for 6 months. They come out. They can't get a job because of their criminal record. They can't get housing because of their criminal record. So we have these systems that need to be fixed so people don't continue to experience homelessness. And probably for this group where we talk about intimate partner violence and why. So one of the largest factors that plays into people experiencing homelessness is traumatic events. So there's a job loss or house fire, but it's also family breakdown. So what 80% of youth under the age of 16 who experience homelessness will talk about it was family breakdown, divorce, violence in the household, etc., addictions in the household, and that kind of thing moving forward. So family breakdown plays a huge role in experiencing homelessness. And so let's talk a little bit about survivors facing situations of domestic violence and homelessness. So 7 in 10 people who experience family violence are women and girls. Research has shown that the majority of families experiencing homelessness are led by sole support mothers. And in 2012, sole support mothers were the fastest growing demographic accessing homeless shelters, so not including the AW shelters as well. So you see a trend there, and not a great trend to follow. In 2017, as the National Housing Strategy was being put together, a think tank of some very brilliant women came together and made recommendations and just made the government aware of what was going on and what was needed to support women fleeing violence in the housing sector. And so one of the recommendations was to incorporate an intersectional human rights gender approach that recognizes the links between the lack of housing, homelessness, poverty, and economic security, colonization, racism, ableism, child intervention, and violence against women living at different intersections. So it's really, we can't lump everyone and serve everyone the same way moving forward. There's different needs. That's one of the reasons at Blue Door why we set up 2S LGBTQ plus housing for youth experiencing homelessness from that community, because there's different needs there too. And we had 2 research surveys that showed us that for sure. And again, require current funding definitions of homelessness to be more inclusive of women, recognizing that their homelessness is invisible, as we talked about before, and that women who experience violence in their own homes are homeless. Women who flee violence are homeless. Women who stay in women's shelters are homeless. And women who couch surf with family, friends, and strangers are homeless. We talked about that invisibility and for women fleeing violence. There's a real stigma to it as well, right? Where no one wants to say, I'm staying at a homeless shelter, especially youth or women fleeing violence. There's a stigma to it. They want, especially for youth, they want to fit in. So we changed the language around it where, are you homeless to, do you need a place to crash? If people don't know what couch surfing is, it is not a fun event. Couch surfing just means that you're staying at different people's houses, maybe staying on their couch because you don't have housing. Precarious housing is there as well. Housing that's not safe, stable, or affordable factors into homelessness as well. Create an Indigenous housing strategy that specific to the needs of Indigenous women and their families, both on and off reserve. That still really hasn't happened. In the last budget, the Liberal government put about, I think, $300 million towards the Indigenous strategy and much, much more. It's just a small piece of what the Indigenous caucus was actually looking for to move that forward because of the need there. Significantly increase the supply of social housing units and require that minimum of so we need more housing. We need actually more, and it's not just about housing. You can't just put someone into housing. We'll talk about housing first. It really is about supportive housing, a supportive community, making sure, yes, that it's affordable, but there's supports wrapped around the individuals based on their specific needs. Flexibility, we established the Shelter Enhancement Fund and dedicate 10% and the National Housing Fund for shelters and additional funds for a continuum of housing for gender-based violence survivors. So again, different needs, not enough shelter beds, not enough specific shelter beds for women fleeing violence. And we need to see that with an increase in beds for VAW shelters, and also for secondary housing as well, like transitional supportive housing as well. So lots of recommendations here that came out of it. A continuum there you see as we go through. I'm just picking through it here for the sake of time. And we'll make the slides available too. Support a continuum of housing beyond Housing First, dedicating, including funding for permanent temporary supportive housing, for sure. And that's part of the challenge with VAW shelters is that they're full and there's nowhere to go and there's nowhere safe to go and affordable. So they end up staying longer. So we need more of that secondary supportive housing moving forward. Homelessness is, people experiencing homelessness, it is so tough. But of course, there's a huge cost to it as well. So you see their annual cost of homelessness in Canada is $7 billion, and that was in 2013. So I'm sure it's way past $10 billion. Now, annually, if we spent $4 billion around prevention, we could actually prevent homelessness, right? So not only are you saving lives through prevention, you're saving dollars. But you see here too, shelter beds are very expensive. That's for a month. That cost has gone way up too since these numbers were published in 2017. If someone's incarcerated, even more, staying in a hospital bed. And quite often what happens is hospitals do not want to discharge people into homelessness, so they keep them longer than they should, right? So and it's a very expensive bed, and they're just unsure. So there's a gap there between people entering the hospital and finding adequate supportive housing. And the other piece to that too, we'll discuss that housing and health are so linked, right? So we have to work better with our partners in healthcare. And then you see transitional housing, the cost comes down. That's about a 1-bedroom apartment there, probably a little higher now, and affordable housing. And that is, when it says $600, that's actually rent geared to income. We're talking about affordable housing too. Part of the challenge when you, right now in the election and different things going on, when they talk about affordable housing, is affordable housing defined by the Canada Housing and Mortgage Corporation is 80% of market rent. 80% of $1,800 is still not even close to being affordable to someone who might be on Ontario Works or on disability or with very limited, who has an income below the poverty line, right? Who's making minimum wage. So affordable to who is the big question. We always use rent geared to income. And that is, where it is that 30% of your income and your rent is geared towards that. And you see that cost of hospitalization annually, housed person versus person experiencing homelessness. So a person experiencing homelessness goes to the ER roughly 5 times more than someone who's housed. So housing and health, very much linked. Homelessness is very expensive. It costs a heck of a lot less to do more than to do less, and it saves lives. Health and homelessness. Dr. Sandy Bachman, I believe he's not anymore, but he used to be the head of the Canadian Medical Association. When I heard him speak, he was talking about how he could tell people's health by their postal code. So we don't have equal access to health care. And for many women fleeing violence who have to leave their lives behind, leave their ID, everything they have, access to health care becomes very, very tricky, right? And you can't retain housing if you're not healthy. You can't be healthy if you don't have housing, etc. So there's just a little infographic here that talks about how poverty and poor housing affect child health. It shows about ear infections, gastro problems. Now that's usually emotional as well. Asthma, they're sick. When you just can't rest. And that constant stress on you to not have a safe, permanent place to call home, this one happens as well. So you see, none of this is good news. And we do try and focus on a trauma-informed approach when we're working with people experiencing homelessness, women fleeing violence. Until you deal with that trauma, we may not be able to house them permanently because you have to have a trauma-informed approach, right? So let's talk about housing first. The core of housing first just means that there used to be an old school approach that we would say, okay, Michael, before you get housed, we need you to be sober, and we need you to have a job, and we need you to plus, 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 plus. And that would never happen. So I'd never get housing, right? And then we came to the realization that if we could get, and again, it's not just four walls and a roof, if we could get people housing with supports, then they're able to get healthy. They may be able to work on employment goals and move forward. They may be able to return to school. So all these different things, right? So I had that housing first approach, but it looks different for different populations. Housing first for women fleeing violence looks a little different because there's different supports needed around that. For 2S LGBTQ plus youth looks a little different. For youth, for seniors, again, looks a little different, right? And it's, you see here the core principles. The other thing too around housing, and we've learned this, I've learned this through failing. A lot of the stuff I've learned is because we did it wrong the first time. And thankfully we learned from that, is it used to be housing first. Okay, well, we got you at a house. That's awesome, great. But think about 30 women living together. That becomes their family. The staff become their family. They're having meals together. They're doing things. And we take that individual or that family, we put them in housing. They no longer have that family. No one's asking when they're coming or going. There's no contact. There's no meals. And sometimes they'll self-sabotage, right? Because we didn't build a sense of community. So community is important in housing people too, and those wraparound supports after. We'll talk a little bit about that. We'll talk about how we need to move towards, we need to have some resources, not just in emergency, but in prevention and aftercare as well, because it doesn't end with housing. And this is what we're talking about here. For the longest time, and even at Blue Door, I talked about 35 years, it was all about emergency housing. And we'd say, well, you know what? And emergency housing was horrible, to be honest. You know, if I described to you a room with very little daylight, kind of a concrete room with 30 bunk beds, people say, oh, that sounds like jail. And that's how we were designing emergency shelters. Listen, this is someone's home, even for a night. And it has to be dignified. And there has to be privacy. And there has to be compassion, right, involved in that too. So we've been designing emergency housing a lot different. But that's not the only answer. It's really, really expensive. And it's not for everyone. So it took us a long time. So when we look at the on the left, like that prevention, holding the blocks from falling down, it could be something as simple as diversion in homelessness, right? So it's simply before when people would call in and say, hey, do you have a shelter bed? We'd say yes or no. Now it's asking a series of different questions because maybe they're okay and that they could keep their housing. Maybe they need to work through an evictions piece. Maybe they need a couple $100s to keep the housing they have now. Maybe we could do some family interventions for them to stay where they are. Going into a shelter is a slippery slope, right? And not everyone has to enter into that. Prevention also can look like school-based interventions. Out of Australia, there's something called the Geelong Project. We call it Upstream in Canada. So it's working further upstream. So if we go into high schools and we can prevent dropouts, which lead to homelessness, through doing different surveys to see what students are in need of immediate help. We can wrap those around kids. And in Geelong, they did this, and they did over 10 years, their dropout rate literally dropped to zero. Their shelters, their youth shelters, emptied out. Prevention has to be focused on, right? We can't end homelessness if we don't stop it from starting in the first place. And that's with evictions as well. A lot of preventing evictions. So many people get a letter from a landlord that says you have to be out by Friday and say, okay. They don't know they can challenge that. They don't know that what they're asking for might be unreasonable, that there's a process to move forward. And sometimes, you know, the landlord is not acting in their best interest, right? So we need to focus and put some resources into prevention. We also need to focus on the aftercare as well, wrapping supports around people so they're able to keep their housing, because there will be bumps in the road. So let's take that pot of resources and make sure that it's not all going into emergency housing. We have to get away also from thinking that good enough kind of thought. Well, you know, we've got a bed, we've got this, that's good enough. And the intentions are good, but good enough for who? Good enough is not good enough. We have to have great programs and resources to help people work through physical and mental health challenges, through addictions. We need family reconnection programs. We need housing workers to work with landlords alongside with individuals to negotiate fair leases and fair rent and that kind of a thing, and to get them to, if they need rent geared to income or different programs, to link them to those programs moving forward, right? So we need that aftercare support. We have to move away from just thinking, let's add more emergency beds. Really expensive and not all that effective too. So let's talk about innovation. Right now, if you're looking, I was talking with Liz before this, and if you're looking for the negative, very easy to find in the news. We hear about the housing crisis, costs are going up, interest rates are going up, inflation is crazy, gas is up, rents are through the roof, hard to find places. So a lot of negative. But there's a lot of cool innovation happening around the world. And I have to tell you, when we push through this, the key to preventing and ending homelessness is innovation. We look at a country like Finland. Finland is the closest country, or is the country that's closest to ending homelessness. They used to have, and this is an example of 20 years ago, they had 600 shelter beds. Now they reduced that to 52. They didn't just cut beds, but they made it a part of their national plan to continuously build various models of affordable supportive housing. Not just one model, but a bunch, and they added. In the early 90s, the federal government used to build thousands of affordable homes every year. And in the early 90s, they got out of that business. The federal government is no longer in the housing business. And you just saw the number of people experiencing homelessness skyrocket. And now, we're 30 years behind. We're trying to catch up. So there's no easy solutions, but we have to think a little different. Blue Doors construct social enterprise. So which is amazing too for cohorts of women fleeing violence. I talked about doing things wrong for the longest time and learning from those mistakes. One of the things we've done is we would take any job and say, okay, Michael, we're going to put you in this job. You're going to have terrible hours. You're not going to make a living wage. And it's not real meaningful work. And we wonder why it would fail. And it wouldn't lift them out of poverty. It wouldn't be a way to pay the rent and pay for your family to eat. So we thought a little differently. There's a huge gap right now. People are retiring in the trades. Plus, we need people to build those thousands of homes that all levels of government are promising, right? So our construction social enterprise was, and it wasn't our original idea, and they don't have to be. You could borrow from other parts of the country or around the world. And really what it was is we have a construction company at Blue Door with a social purpose. So if someone came to your house to do a renovation, it'd be done by the experts with a fair market price. What you're not paying for the 6 to 8 women, men, or youth or newcomers that come with them that are getting 6 to 8 weeks of paid experience and then being launched into the trades where they start at $21 to $28 an hour. Coincidentally, what you need to afford a 1-bedroom apartment in the GTA. It's meaningful work. You could point at and say, I did that. As you work towards apprenticeship, you can take that anywhere in the country, around the world, right? It's great work. So it's a different model of doing things. 360 Kids in York region. I worked there for a while at Clovis Grant and his team are doing amazing work there. They have a program they borrowed from the UK called Night Stop. And it's for some kids that maybe they just need a night away, a break from the family, instead of going into a shelter, which I talked about being a slippery slope. And they're very scared and nervous. Maybe that's not where they need to go. Host home families is a family with extra space who's screened and trained, actually takes the kids in for a couple nights and they stay with that family. So you have host homes. And they've been doing this in the UK for over 30 years. If you look at the UK, there are 50 million people. An island, it's pretty small. So they've had to be creative in how they do this. And Night Stop's one of the ways of doing that. And also it's just the way we operate emergency shelter as well. And the Calgary Drop-In Center, I think, has close to 1,000 shelter spots. And for the longest time, they were just taking care of people, which is great. They need to be taken care of. But everyone in the Calgary Drop-In Center deserves a safe place to call home, a key to their front door, to privacy, to dignity. And instead of just taking care of them, they worked rapidly to rehouse people when they came in. They had people that were there for 30 years that they housed. Were happy and had their own housing with the right supports wrapped around it. So it's taking a different approach to that. As soon as people come in and they're ready, and everyone's ready at their own time, but really working, what is your housing plan? Let's start working on your housing plan. That housing approach to getting them in out of the shelter, right? Shelters are expensive, not a great place to be sometimes, because they're busy places, especially during the pandemic. We heard there was overcrowding, etc. Let's get people into dignified, affordable, safe housing moving forward. So innovation plays a huge part. And this is just when we talk about Blue Door innovation where I am. I talked about our construction social enterprise, community land trust. We're setting up a community land trust in York Region. What that is really, it's a mechanism for developers, mayors, and others. If they have housing, they put it into a trust, and there's a board of directors of the trust, and nonprofits like Blue Door, like Yellow Brick House, and like others can apply to operate that housing really without any cost. But the asset always stays in the trust forever, so it remains affordable housing forever. So they move forward and they're able to manage that trust. So it's a different way, and that's really simplifying it, but it's a different way of, and it gives people, mayors and such who say, I can't just give to one group. They give to the trust, and it's sorted through everyone has equal opportunity to attain that housing moving forward. Canada Parks Home. So Parks Canada has 44 vacant homes in the Rouge Valley Park in the Markham-Stouffville area. And they're just vacant homes, but they don't have the capital to fix them. Blue Door, through various different federal programs and local programs, were able to raise $300,000. We turned it into a duplex. It's still owned by Parks Canada, but what we have is a 30-year lease for $0, where we turned it into a duplex for two families. So we've just created 30 years of affordable housing for two families, rent geared to income, right? So it's being creative and looking for those types of properties. And one of the things we have to get better at too is I talked about Indigenous people being overrepresented when it comes to experiencing homelessness. It should be Indigenous-led organizations that are doing that work. So in York Region, when we saw that, I think it was about 70% of people experiencing homelessness identified as Indigenous. Instead of trying to do that work and doing it wrong or inappropriately, we partnered with Native American residents, or NAMA Res, for Indigenous services. So we worked together to find funding. Now they're operating outreach services up in York Region. So it is just being innovative in how we tackle this. Lastly, I just want to, if you're interested in housing homelessness, like a few years back, we started, 3 years almost ago, we started a podcast called Out of the Blue. It has since changed to On the Way Home. It's Blue Door and the Canadian Alliance and Homelessness, weekly podcast, onthewayhome.ca. And it's great because we have the best, the brightest. We have lived experts. These are people that may have experience in homelessness or experienced homelessness. We have lived experts and others who come on from healthcare to housing, from Finland to Norway to the UK, across Canada. What are the challenges? What's working well? What isn't? We've talked to people about 3D house printing. Today we had the first ever federal housing advocate, Marie-Josée Oulet, who is just incredible. And that's part of the national housing strategy that came about in 2017. But I thought for everyone here, if you want to just pick one, the brilliant Caitlin Swan and Khulud Bank from the Women's National Housing and Homelessness Network, they were on, and they were talking about a survey they did, a Pan-Canadian Women's Housing and Homelessness Survey. It was excellent. But there's 60 or 70 podcasts you can listen to. A new one drops every week. So at this point, Liz, I'm going to open it up to questions. I think we have about 13 minutes.
Yes, we have just over, around 12 minutes. Actually, there was a great commentary on the screen. I'm going to try to capture a summary, but and I'll just refer to my notes. But Mary mentioned not having a perfect credit system, perfect credit due to it being ruined. Makes it really difficult to get an apartment. And I would say Shannon also agrees with that exact scenario happened to her and not receiving child support. So I'm going to sum that up, and maybe you have a comment on that to assist, and then we have another question.
Yeah, so right now it's so difficult for individuals who had to flee, who might have had their credit ruined. And regardless whether, if you have bad credit, you think about for landlords right now in the private market, they've got, maybe they have Liz who can give you 6 months of rent in advance. And they're asking for crazy things right now because they can't, right? People say, well, are they allowed to? It doesn't matter. They'll find someone else to do it. Or they have our clients that might have not great credit. So of course, it's really hard to find housing in the private sector. Here and there, you may have landlords that are that will work with you. But really, that is why we need to be innovative and create and have nonprofits creating their own housing. So it's rent geared to income, so that credit score doesn't matter. We have to be more creative around that because yes, that's a huge barrier to accessing housing.
Right. And feel free, everyone, to send a quick comment if you like. We have about 10 minutes left before 3 o'clock, and then Michael can respond. The next question is actually my question. How do you see the current economic landscape with rising inflation and supply chain issues impacting all communities across Canada?
Well, I think if you look at, so there's a researcher, Nick Falvo, he teaches Homelessness 101, and he does great work. He's a consultant. And he talked about early in the pandemic, he said, actually, we won't see the worst of the pandemic affecting our most vulnerable till 3 years after the pandemic ends. So the next 3 years are going to be very, very tough. And he was right. You see inflation, and yes, it affects everyone, but it affects our most vulnerable the most, right? Where rents have come up. When we go to, I was talking to one of my team the other day, and they said, when we finally find that unicorn of a home that might be affordable, we go there, and there's 4 other agencies with their clients there as well, right? So very, very tough. We have to rapidly, there's a big talk about building housing and affordable housing, but we have to, that housing, a large portion of that has to be owned and operated by the nonprofit, charitable sector, housing sector. Otherwise, when it's owned privately, you're not guaranteed that it's going to be truly affordable. And that has to be the way. There has to be a government push to do that. It has to be more rent geared to income. And we also have to look at income supports too. The Globe and Mail put out something a couple of weeks back that said to afford a 1-bedroom apartment in the GTA, you needed to have a household income of $90,000 a year. And you think about someone in Ontario works, may receive about $8,000, and disability maybe around $13,000 a year. Massive gap, right? And that keeps getting bigger and bigger. So we have to, and you see that all 3 of the parties, some of the different levels, have talked about finally increasing OW and ODSP, because it's desperately needed. It's been about 25 years since we've seen any significant rate changes in those. Definitely, there's an income piece.
Your percentage of 80% of having to come up with the funds, that was shocking for me. I don't see any other questions in the chat. If there are any questions, feel free to reach out to Michael. Michael's also on LinkedIn as well. So please connect with him. And thank you for a fantastic presentation. It was very informative, Michael. And we have, when we close, we have about a 15-minute break at 3 o'clock, starting 3 o'clock, and then the next session will be at 3:15. So we're looking forward to you continuing to join us on the next session. Michael, thank you so much. It was great meeting you as well, and really appreciate your talk today.
Thank you, Liz. Great to be here, and everyone, please enjoy the conference. It is excellent, and there's some amazing speakers there.
Thank you, Michael. And you're getting a lot of thanks in the chat as well. Okay, take care. Have a great afternoon, everyone. See you on the next session.